This week on Healthy Living, we highlight drug addiction and its impact in our community. How in Washington State, librarians are becoming first responders in fentanyl opioid crisis. Plus, researchers identify a severe form of Mpox in people with HIV. That's in this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Kamiti Kibayasi. Many people don't understand why or how people become addicted to drugs. In reality, drug addiction is a complex disease and quitting usually takes more than good intention or strong will. Cocaine manufacture was at record high in 2020, growing 11% from 2019 to over 1,900 tons, according to the UN Office on Drugs and Crime World Report 2022. In parts of the world, cannabis legalization appears to have increased daily cannabis use, particularly among young adults. In Mozambique, people say drug use has left behind a trail of broken families and dashed dreams. A rehabilitation center in Maputo is helping former addicts take the first steps toward recovery. Sergio Jambi reports for VOA from Maputo.
Behind a simple corrugated metal gate on a dirt road in Mozambique's capital, Maputo, lives are being changed. People are fighting to take their lives back from the grip of drug addiction. A 29-year-old man is one of the People Action Group Against Drugs in South Africa, or Agadia, is providing shelter for and supporting. He is currently undergoing treatment and asked to remain anonymous because of the stigma attached to addiction. The young man says the center is giving hope to those who struggled with substance abuse and giving them a fresh path to recovery. But, he says, the temptation is everywhere in a city.
I started using cannabis here in Maputo City. They even sell them at the store. They sell their own special paper for cannabis. It's normalized and looks like something you can find anywhere.
Addiction struggles aren't limited to cannabis, as some dealers reportedly sprinkle heroin, commonly referred to as brown dust, with the aim of hooking victims to stronger substances. Mozambique has served as a transit location for cheap drugs for over 2 decades, according to a 2018 study published by Geneva-based Global Initiative Against Transnational Organized Crime, and young men and women fall prey to such traps. The president of Agadia says the young man arrived at the center in a fragile state and has been under treatment there for 6 months.
He entered the program in a very critical phase because he was locked in the room. He never let anyone in the room when we went to get him. He didn't sweep the room. He didn't wash his clothes. He didn't even want to take a shower. He just wanted to smoke.
More than 38 million adults in Africa, or about 7.7% of the population, consume cannabis. This is about twice the rate of the world population, according to the UNODC. Mozambique has seen a rise in heroin use since it is a transit point in the trade between Afghanistan and Europe. As much as 40 metric tons of heroin pass through the country each year, according to experts. The Agadia Center care providers say people struggling with addiction share similar profiles and arrived in an already advanced state of dependency. That's exactly what happened to this recovering addict.
To sleep, I had to smoke. To wake up and see things, I had to smoke. Only after that, I could go through life. Before smoking, I wasn't able to process things well.
He says he ignored the first signs of addiction, and the next thing he knew, he brought terror to his family and the community at large.
I vandalized. I stole. I did a lot of things that didn't make sense. Sometimes when I remember that life, I get a little uncomfortable because it wasn't a good thing.
He says he hit rock bottom before he enrolled in Agadir and made the decision to beat drugs. Today, he works as a security guard at the center. Agadir was created in South Africa and opened its office in Mozambique 4 years ago. Rehabilitation is provided to recovering addicts in the form of natural remedies such as capsules and psychological support. The center rehabilitates over 80 people annually.
Even if I could rehabilitate one person a month, I feel like I saved a family's life. I feel that I saved the life of a country. I feel that I saved the life of a society, and that is very moving.
Peter Mwalukumbi Mjomba is a medical psychologist who works in rehabilitation center in Mombasa, Kenya, named Rima Serene Medical Center. He explains how you can tell if someone has drug addiction.
There are certain behaviors that someone exhibits when they have an addiction. First of all, if this person is shy when they're using drugs, maybe they're guilty about their using, how much they use, what kind of drug they're using, they tend to isolate themselves. If it's a family gathering, they will not come together in the gathering. They'll not join the other relatives in the gathering. They'll instead have their own moment. Another thing that you will notice with a drug addict is maintenance, hygiene. For an addict, not all addicts are good at maintaining themselves. Maybe combing their hair, putting on nice clean clothes, going to shower every day, brushing their teeth. Many addicts neglect these duties. They do not focus on these duties. They don't keep themselves clean. And some other thing that you will notice is drop in performance in school because drugs come with mind-altering effects. You won't be able to judge things correctly. You won't be able to make appropriate decisions at work. Even your relation with other co-workers will change. Men are more likely to become addicts than female, but women are more likely to transition from substance abuse to substance dependence and addiction. And women are also more likely to self-medicate with illicit substances, like abusing these prescription pills. Maybe it's a drug like fentanyl, and fentanyl has a quite high death rate in America. Fentanyl is a really strong opioid, around 100 times more powerful than morphine. Men also are more likely to abuse substances due to peer pressure or to be part of a group. But on the recovery rate, it totally depends on the person. Doesn't matter you're male, doesn't matter you're female. If you're willing to change, you're willing to change, and you will change if you get the right help. The time that it takes for someone to recover or to completely quit totally depends on themselves and their response to the medication we give them and their response to treatment as a whole, because treatment involves two things. First is the counseling part, and there is the medical part. The medical part, we have so many drugs that we can give an addict in recovery. And if it's a psychotic patient, we'll be getting them antipsychotics. There are many antipsychotics and many other drugs that we use to handle these clients when they come in with their addiction. The dose that he or she started with on day one is not the dose that he or she will finish with on the last day. Yeah. Maybe they started with 4 milligrams twice a day, they go to 2 milligrams twice a day, they go to 1 milligram twice a day, to once a day, and that's it. We cut them off from the medication. And on the counseling part, 2 good months is purely counseling, and the 3rd month is majorly on the exit plan, because what is the environment this client is going back to when they leave the rehab? Maybe they're going back to the same toxic environment that started this problem in the first place. So we have to watch out for such things in our counseling session.
Overdose deaths from the drug fentanyl have communities across the United States scrambling to respond. In Washington state, librarians are becoming unlikely first responders in this latest wave of the U.S. opioid crisis. Natasha Mogovaya has our report.
just hold it like this. You don't want to drop it because it can deploy the spray, but it's not harmful if it gets deployed. You just have to start again with another one.
Gabi Fuentes is explaining a new skill learned by her library staff, administering an emergency drug that can temporarily reverse opioid overdoses. In America's deepening fight against the drug fentanyl, Tacoma's library now has a dispensing machine for the potentially life-saving antidote naloxone, alongside its free hot coffee and COVID tests.
We worked with the Tacoma Needle Exchange to create a contract, basically, to help us support our patrons that have substance use disorders. So we realized there was a community need.
Yeah, it's a community hub, a place for people to gather, and so it's, just the ideal place for something like that, because you never know who's gonna walk through the door and who's gonna need, help.
Library associate Tony Sonsteng understands the training, but wonders what might happen if the time comes to use naloxone, which is also known by its brand name Narcan.
I mean, I'd like to think that I would be able to do it, but I might need to find somebody else just to support me if I needed it. We were a little bit nervous at first just to see what people's reactions were going to be.
Putting it up in a public vicinity of the public is letting them know that it's okay to do it. I carry Narcan on me because I have friends that do it, so but I don't think you should go in public places because there's kids in this place and stuff.
Washington State Health Officer enacted a standing order allowing anyone here to obtain naloxone without a prescription. University of Washington epidemiologist Caleb Banta-Green says making it accessible will prevent more death.
There's good evidence we keep seeing over and over and over again that of all of the populations you want to make sure have naloxone, it's people who use opioids and or those who are friends and family and loved ones of them. They're most likely to see an overdose and most likely to see the greatest number of overdoses.
More than 110,000 people died from fentanyl overdoses in the United States last year. Fuentes says helping respond to the crisis is part of the library serving its community.
A lot of people have reached out to us to say they've lost family members to addiction recently, and this, just knowing that they have the tool to be able to prevent a death like that has just been so important to our community.
With 2 expert panels unanimously advising the U.S. Food and Drug Administration to approve making naloxone available without a prescription, machines like this could soon become a familiar sight in other public institutions. Natasha Mozgovaya, VOA News, Tacoma, Washington.
Researchers said they have identified a particularly severe form of mpox in people with advanced HIV, which had a death rate of 15% among patients with AIDS. Mpox, previously known as monkeypox, has long been endemic in several African countries, but started spreading across the world May last year, overwhelmingly affecting men who have sex with men. Between 38 to 50% of global mpox patients were also living with HIV, according to a new study published in the Lancet journal. For the study, an international team of clinicians looked at 382 people with both HIV and mpox from 19 countries. That number included 27 people who died of the disease, more than a quarter of the total toll during the global outbreak. The clinicians identified a particularly extreme form of the disease, which they called fulminant mpox, that affected people with advanced HIV or AIDS. Symptoms include massive necrotizing lesions on the skin, genitals, and sometimes even lungs. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at MkamitiVOA. Until next time, stay well and strive to make every day a healthy day.